Today we are joined by Katie Ellison. Katie is the project director for the Safer Homes Collaborative at the Missouri Institute of Mental Health. She has over 20 years of experience in suicide prevention, working in research and program implementation, prevention, policy, and programming in K-12 public education, as well as adult and youth corrections. Ms. Ellison developed the suicide lifeguard training at Missouri Institute of Mental Health, a training for professionals on suicide prevention, intervention, assessment, and management training for licensure in the state of Missouri. She is a member of the St. Louis Regional Suicide Prevention Coalition and the American Association of Suicidology. Please join me in welcoming Katie.
Good morning, everyone, and thank you for joining this webinar on conversations on access to lethal means. I just want to take a few minutes before we get started on this training to acknowledge those who worked tirelessly to develop this workshop. This is the original body of work from Elaine Frank, Dr. Mark Sioko, and Kathy Barber from the Harvard Injury Control Research Center. It was adapted from the Counseling on Access to Lethal Means training that was originally developed for behavioral health providers and medical providers to have these conversations with patients and clients in the hospital or in the professional setting. So they helped worked with us with the Safer Homes Collaborative to adapt this training for the general public about 2 years ago. This project was funded through the Missouri Foundation for Health, and as well we use some materials, particularly our videos, that were provided or created by the Utah Suicide Prevention Coalition, as well as the New Hampshire Firearm Safety Coalition. So when we talk about having conversations on lethal means, and reducing access to means that people use in suicide attempts, we want to frame this conversation in terms of thinking about standard home safety and how we all work to make our homes safer when we have young people, little children that live with us. We remove sharp instruments from their reach. We put buffers around short corners. We put plugs in electrical outlets. We develop fire escape plans with our children when they're young. We install smoke detectors and carbon monoxide detectors to alert us if there is carbon monoxide or smoke in our home. We try to keep floors and surfaces free from trip hazards, and we store our medication safely. So thinking of it in kind of those same contexts and in same ways is how we want to frame and think about reducing access to those ways in which folks attempt to take their life in a moment of extreme despair and despondency. So we want you to add considering temporary off-site storage of firearms if you or a family member may be going through a rough time or are feeling suicidal. And that's what we're going to talk about today. So why should we talk about suicide, and why should we talk about suicide and guns? Well, in Missouri, suicide is the 10th leading cause of death for all age groups. It's the second leading cause of death for our young people, ages 10 to 34, second only to accidents. The suicide rate across the United States and in Missouri particularly has increased by 30% over the last 2 decades. So it's on the rise. But also we want to talk about firearms in terms of suicide, because 82% of youth who suicide with a firearm use a firearm that's owned by a family member. And that family member is oftentimes their parents. They have access to it within the home. We also want to talk about suicide and guns in particular, because research has shown that by talking about suicide, we can prevent suicide. The myth is that if we talk about suicide, we will cause people to want to suicide. And the reality is that how we talk about it, if we talk about suicide or talk about feelings of suicide in terms of getting people to help and making our environments safer so that folks do not have access to those lethal means, or it would be harder for them to access those lethal means, we can actually prevent suicide. Now, you don't have to be a trained professional to prevent suicide. You don't have to have 20 years of experience or a master's degree in psychology to prevent suicide. Everyone can do this. Just like everyone can learn from first aid safety or learn from how to do CPR, everyone can learn to have conversations on reducing access to lethal means. Everyone can learn to have these conversations. And the bottom line is that we want to talk about suicide because suicide is generally preventable. Now, can we prevent all suicides? No, but we could prevent many suicides just by taking some precautionary steps and being willing to have these conversations. So what leads to concern about suicide? Well, just kind of reviewing those risk factors about suicide that many of you may be aware of or familiar with. You know, those symptoms of depression, experience of depression, feeling angry, having impulsive behavior tendencies. It can be situational in terms of an extreme response to facing a breakup, or a legal trouble, or some other type of life crisis or setback. Using drugs or alcohol can enhance or increase the risk for suicide as it disinhibits a person who may already be facing or struggling with thoughts of suicide. Someone who is withdrawing from usual activities, that could be in addition to the presence of other risk factors and warning signs. This could signal that this person is struggling with depression and may signal that they are struggling with thoughts about suicide. Sometimes people who are thinking about suicide use coded messages and they may express feeling that as though they or their family or their loved ones would be better off if they were dead. They share messages of having a loss of hope that things can get better, or hope for a future. They cannot see their situation improving. They may not even have hope that someone can help them. They may have lost that hope because what has worked or what they have tried in the past is no longer working for them. They may be acting reckless in concerning ways and taking risks that would put their life in jeopardy. They may express feelings of being trapped in their situation and that there is no escape. And then in addition to all of these other concerns for suicide is having access to lethal means. And what are lethal means? Well, those are access to a gun, access to pills. Perhaps it's access to toxic chemicals, poisons, having access to cars or heights. And we're going to talk about some of those as we move on. So let's reframe some of the warning signs for suicide. Now, keep in context that signs for depression or signs for suicide can be a constant normal for someone. So think about this in terms of a change from what is typical or what is expected for this person, what you know as to be a change from the norm for your loved one. So a change in their mood, a major life change. Maybe they're facing a breakup with a boyfriend or girlfriend. Maybe they're going through a divorce. Maybe there's a major life change in terms of their legal situation. Maybe they've been arrested, or they're facing some type of economic or financial hardship. Maybe they've lost their job. Perhaps their use of substances, of either alcohol or prescription drugs or recreational drugs, has increased, or it's volatile, or they're not using it in the way that it's been prescribed. Their behaviors are changing, again, withdrawing from the usual activities that were once pleasurable, or they're no longer able to get themselves out of bed, or they're calling in sick to work or to school, or maybe they're giving things away, or they're making arrangements for the end of their life. And then noticing a change in their affect or their emotion. Again, talking about a sense of hopelessness, or a sense of being a burden, or feeling trapped or stuck. So as I mentioned at the beginning, this this workshop is based on the clinical model of calm that was developed in 2006. That's a whole 3-hour training. So this is just going to be a condensed, shortened version, 1 hour. Keep in mind that calm conversations on access to lethal means is part of a comprehensive suicide prevention or intervention. It's not the whole thing. It's not the only answer, but it is part of, and it can be a very effective part of preventing suicide. And so we want you to think about adding this to the tool belt that you already have, what you already know about how you can prevent suicide in your home, or with your friends or family members, or in your community. Now, the one takeaway I want you to hear today is that calm conversations on access to lethal means is anti-suicide. It's not about being anti-gun, nor about anti-drugs. Medications, drugs are a tool. They have a legitimate purpose. Firearms are a tool. We are not anti-gun by any means, but we are anti-suicide. And if we can take steps to render those tools safer in the home, then we can prevent suicide. So can it work? Can this reducing access to lethal means work? And research has shown that with effort, yes, we can have success. There are several examples out there across the world about how reducing access to lethal means in other parts of the world, the most lethal means in other parts of the world, has actually prevented suicide. So let's take a look. So in Sri Lanka, pesticides were the leading suicide method in Asia. And their rates rose 8-fold from 1950 to 1995. They were extremely toxic and quite readily available in the fields to fertilize their agricultural fields. But they placed restrictions on the sales and the storage of the most toxic pesticides in the late 1990s. And that one change, that one system and policy change, showed a suicide rate reduction by 50% from 1996 to 2005. During that same time period, non-fatal poisonings did not go up or did not increase, nor did they decrease. So we just know that from changing the toxicity and also the way those pesticides were stored, making them less easily accessible, reduced the suicide rates in Sri Lanka, but the suicide poisoning rates in Sri Lanka. Now we also know from when they changed from using coal to natural gas in Great Britain, that created a change in suicide statistics. When they made that policy change, that systemic change, their suicide rates dropped in Great Britain. Here in the United States, dying by carbon monoxide poisoning was a prolific method for suicide. However, back in 1975, the automotive industry changed to, well, actually the automotive industry changed to catalytic converters because of EPA standards and having to reduce carbon emissions from vehicles. And when they introduced the catalytic converter and reduced the amount of carbon monoxide that your vehicle emits when it's running, suicide rates decreased by this method as well. In Canada, the Prince Edward Viaduct was a bridge that was quite frequently used for suicide deaths. Now, what they did here in Canada was they installed this barrier. I don't know if you can see it in this picture quite well. They installed a barrier along the top of the bridge that has metal rods that are slotted like relatively closely apart, and I can't remember the exact distance, but basically making it impossible for a body to fit in between the barriers. And so when they did that, suicide deaths by dropping off the Prince Edward Viaduct all but ceased because they created a barrier that prevented folks from jumping to the death. And then in this picture, you'll see they also made a beautiful cityscape by lighting it up, and now it is a destination point for visitors to go and see the beautifully lit up bridge. In Israel, all young people over the age of 18 and after you graduate from high school have to go into the Israeli Defense Force. And it used to be that they had the policy and practice that their servicemen and women could take their firearms home with them over the weekend. And they were seeing their suicide rates over time. Their suicides were occurring on the weekends when their young men and women were isolated. They're possibly isolated, but they also had access to lethal means. So they changed that policy and required them to keep their firearms or leave their firearms on base when they went home over the weekends. And when they made that policy change, their suicide rate by firearm decreased. So that brings us to this training today, where if we have these conversations about reducing access to lethal means, if we start encouraging putting time and distance between a person in crisis and any and all lethal means, or even just the two most predominant means, medications, which are the most common method people attempt suicide, and firearms, which are the most deadly method, and most people die in a suicide attempt by a firearm. If we limit access to those things, we can reduce suicide in our state and in our country. Now I want to show you this video from our friends at the Utah Suicide Prevention Coalition. I want to give you a little bit of warning before I show it that you will hear the sound of gunshot, but no one is injured, no one is harmed. But if you are affected by the sound of a gun firing, please know that you will hear the sound of a gun firing.
Last year I was at my lowest, going through some pretty serious depression. A couple of friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
Okay. So, as we see in this video, oops, I'm sorry, I went to the wrong slide. As we see in this video, his friend spoke to him about temporarily reducing about temporarily reducing his access to firearms. He got them back when things got better, and it saved his life. Okay. Why is calm helpful, or why maybe it helpful? Well, oftentimes people who are having thoughts about suicide are ambivalent about living or dying. They're not sure if they want to keep living. They definitely want their pain to end. And they would choose to go on living if the ways that they had tried to end their pain thus far had worked. But they're not sure that they want to keep going with the way that they're currently feeling. Thoughts about suicide are transient and can be temporary. Suicidal thoughts are not necessarily always a constant drumbeat in someone's head. It can come and go like the tide of the ocean. They can be more frequent and longer, but some are quite short and quite fleeting. It's when they become more frequent and longer that the risk goes up for suicide. Thoughts about suicide can often feel urgent. The urgent need to end their despair, to end their feeling. Thoughts about suicide are often reached very quickly, transitioning from that ambivalence to acting on it. That window of time frame is quite short. And so having access to a firearm, which is the most lethal means, or pills, which are the most common means used in a suicide attempt, if we don't have those already secured, it would be very hard for someone to quickly intervene or interrupt that suicide attempt. And then there's that, calm may be helpful because of the methods, the lethality of different methods vary greatly. Not that we want to educate someone who's at risk for suicide about more effective ways about ending their life, but we want those around them to be aware that some methods are more lethal than others. So these two gentlemen are Kevin Berthia and Kevin, his last name, the other Kevin escapes me. But Kevin Berthia is the young man standing on the ledge on the Golden Gate Bridge. And the other Kevin is the California Highway Safety Patrol officer. And what we see here is Kevin Berthia's ambivalence about living or dying. And the story about the Kevins is that Kevin Berthia stood on that side of the bridge for over 90 minutes. And Kevin Berthia spoke to him during that time about his thoughts about suicide, his reasons for living, and his reasons for dying. And fortunately, Kevin was able to talk Kevin Berthia back over to the other side of the bridge. And now Kevin Berthia spends his time, well, actually both of them are suicide prevention advocates, talking about how getting involved and being willing to talk to someone who is at risk for suicide, that we can talk them back onto the safe side of the bridge. We can take measures to help keep them safe, and that things can get better. Okay, so thoughts of suicide can be temporary. So what percent of nearly lethal suicide attempts eventually die by suicide? Is it 75%? Is it 45%? 25%? Or 10%? 10%. Only 10% of nearly lethal suicide attempts, people who attempt suicide, eventually go on to die by suicide. So this demonstrates for us that once suicidal, not always suicidal. If you survive a suicide attempt, you're not guaranteed to go on and die by suicide. So if we can reduce risk by reducing access to lethal means, we can save even more lives. Let's talk about urgency, the time between suicide as an option and an attempt. Among survivors of near-fatal suicides, when they were asked about the length of time from their decision to complete their suicide or their attempt. 47% of those who participated in the study said it was an hour or less. 24% said it was less than 5 minutes. So here we see that over 70% of people who survived their suicide attempt said that it was less than an hour, sometimes less than 5 minutes between the time they made the decision and they attempted their suicide. So if we put time and some distance between the person who is thinking about suicide and lethal means, we may be able to save their life. All right, not all methods with which people attempt suicide are equally lethal. They have different lethality rates. Firearms have a lethality rate of 57% of people in Missouri who attempt suicide with a firearm, 57% of people in Missouri who attempt suicide will use a firearm, versus 14% of people who do overdose or poisoning, and 24% will suffocate. So here, let's look at it another way. In the United States, those who overdose in their suicide attempt, only 1 to 2% of suicide overdoses are actually fatal. Because medications just are not pills are not the most effective means by which to attempt suicide. And it takes a long time for them to be fatal in the system in order for them to be fatal, versus a firearm, that opportunity or that window for rescue and to get that person to help is negligent at best, or none at worst. Some studies, depending on which one you look at, estimate that death by firearm in a suicide attempt is anywhere from 80 to 90% lethal. So that window of opportunity to rescue someone or save their life or intervene if they attempt suicide with a firearm, again, is quite minimal. And it's an extremely lethal method by which people can end their lives. So why are we focusing on firearms? Well, in the United States, more people die by suicide by using a firearm. Currently, the rate stands at 51% of all suicides in the United States are with a firearm. Here in Missouri, that is upwards of 60% of all suicide deaths are with a firearm. They're almost always fatal with a firearm. And if you do survive a suicide attempt with a firearm, you're left to live with catastrophic and devastating damage to your body. The decision time is relatively brief. If someone can make a decision to attempt suicide and act on it in less than 10 minutes, and a firearm is not secured in the home, it's not locked away from that person at risk, if you're that person's parent or their loved one, are you able to get home in time to secure that firearm and keep it away? So we want to think about how we're going to reduce the access to the firearm before our loved ones are at risk for suicide. They are widely available. In Missouri, 27% of Missouri residents own a firearm. However, upwards of, I believe the statistic is somewhere between 40 and 60% of Missouri homes have a firearm in it. So even though a child may not be the firearm owner, they have access to that firearm. So many of our homes in Missouri have a firearm, and we may have someone who's at risk for suicide to be able to get access to that firearm. And it's culturally acceptable. Missouri is a state that has policy and laws that firearms are easily acceptable. We are a shall issue open carry state, meaning that if you are of legal age, you may go and you don't have any legal impediments to purchasing a firearm, and you can pass the firearm, the background safety check in the state of Missouri as a resident within 20 to 30 minutes. You can walk out of any gun retailer with a firearm. And if you go to a gun show, that window of time may be even less. So it's culturally acceptable to own guns, and they're quite accessible here in the state of Missouri. Versus in other states, you might have more strict gun laws in terms of how you can purchase one. Like, for instance, in the state of Illinois, you have to have a card demonstrating that you have completed firearm safety qualification in order to go and purchase a firearm, meaning it takes a longer time period for someone to go out and purchase a firearm. Okay. So firearm availability as a suicide enabler. Bear with us on the term enabler. We're just kind of using that in context here. So suicide rates vary with rates of firearm ownership. What we mean here is that those who own firearms are at enhanced risk, are at greater risk for dying in a suicide attempt. 82% of youth who die by suicide use a firearm that is owned by a family member, and that is usually a parent. But let's not forget other relatives who have a firearm, their grandparents or uncles or aunts. And then parents often underestimate the likelihood that their children could have or could obtain their firearms. Oftentimes parents assume that their child knows better because they've had firearm safety instruction, that they have done their due diligence to have conversations about how to properly handle a firearm with their children. And that's great, that's good, that's what we want them to do. However, we need to keep in context and in mind with that when that brain is not fully functioning optimally, healthily, and is having messages told to that person that reinforce urges about suicide, it's not about firearm safety training at that point in time. So you may be asking, well, maybe it's not the guns. And maybe it's not. But let's ask ourselves, are people who live in homes with guns more likely to have a mental health problem? Absolutely not. People who live in homes with a gun are no more likely to suffer from a mental health condition. Are people who live in homes with guns more likely to seriously consider suicide? Nope. People who live in homes with guns are not any more likely to consider suicide than someone who lives in a home that doesn't have a gun. Are they more likely to attempt suicide? Again, nope, they're not more likely to attempt suicide. But what is true is that people at risk for suicide who have a gun in the home are more likely to die if they make a suicide attempt because the firearm is so extremely lethal. So who can benefit from CALM? Is it anyone who's expressing suicidal thoughts? Someone who has only a vague suicidal plan? Only someone with a specific suicidal plan? Or anyone struggling with depression and or substance misuse, particularly with additional or potential stressors? What do you think? Who could benefit from CALM? The answer is, all of them. At any point along this continuum, this suicide continuum of expressing thoughts, having a vague plan, maybe having periodically thought about suicide, those who have specific plans, or someone who's just struggling with depression or substance misuse. all along that continuum can benefit from having calm. So using calm, why, when, and where? Why would you use this calm training? When you see the warning signs and the risk factors for suicide, or you just have that gut feeling that I'm really worried about my dad, I'm really worried about my spouse, I'm really worried about my student, I'm really worried about my coworker. When you just have that gut feeling. Again, let's quickly review some warning signs. Feeling trapped, acting reckless, losing hope, depressed, withdrawing from usual activities, using drugs or alcohol, facing a breakup or legal trouble or some other type of life crisis, and talking about being better off dead. Changes in mood, major life change, substance use, behaviors, changes in behaviors from what's the status norm, and a change in their affect or emotion. So when are we going to use calm? We're going to use it as soon as possible, because this could truly be a matter of life versus death. And you're going to use it whenever there's a concern for that person's safety. And where? We're going to use calm where it's convenient, where it's familiar to that person at risk for suicide, and where it is safe. Okay. So how do we have this conversation? You may be feeling some anxiety. Katie, you've been talking about let's have a conversation, and I'm not sure how to do this. Start off by being genuine and being present, and express to the person, I'm concerned for you. I'm concerned for you because I'm seeing these risk factors. I'm seeing that your depression is increasing, that you're withdrawing more, that you've been using alcohol more. I'm worried about you because I've heard you say you're not sure if you can go on living like this. You can start, after you've expressed your concern for them, you can start to go a little deeper into the conversation, and I would encourage you to go deeper into the conversation by asking that person directly, are you thinking about suicide? And I would encourage you to specifically use the word suicide rather than use the euphemism like, are you thinking about hurting yourself? Because those are two distinctly different things, hurting yourself and suicide. And so if you don't ask specifically about suicide, we're not in agreement that we're trying to prevent suicide. So ask them, and it's okay to ask them, are you thinking about suicide? Remember, research has shown us that talking about suicide actually reduces the occurrence of suicide. It can alleviate someone's feelings of isolation and loneliness. So you're not going to plant the seed in their mind about suicide just by asking about it. And then practice. When you have the opportunity, practice saying to your mirror, or practice saying to another person, are you having thoughts of suicide? I'm going to take a pause here in just a minute. We're going to quickly role play. I know it's a little bit hard in this modality because you don't have a partner to role play. But this is a question that can get stuck in your throat when you're really scared about this person's safety and their well-being, and depending on your relationship with this person. So I want you to practice saying it to yourself in the mirror. Are you having thoughts of suicide? Think of it in terms of when you learned to do chest compressions with CPR and it felt really awkward. You weren't sure about the rhythm and you weren't sure how hard to push. But when you practice it, it got easier and you got more comfortable with asking that question. So I'm going to be quiet here for a moment, and I want you just to say to your computer screen, are you having thoughts of suicide? Okay. Hopefully that wasn't too terribly hard. Now, moving on, what do we do when we ask someone that if they're having thoughts of suicide, or if they're thinking about suicide? What do we do if they say no? Follow up with them and say, thank you for telling me. I am still really concerned about you, and I want to ensure that you are safe at home or when you're in my home. I want to get you some help, and I want to talk to you about some resources to get you help. But also, I want to talk about if you have access to any guns in your home, or I know that you have guns in your home. And during this time period, I want to talk to you that it might be safer if we remove the guns from your home just until things get better, just until you're back on your feet, because people can make a rash decision in a moment of despair and despondency. And I want to help keep you safer at home. So you could also say to them, I'm so glad that you're not having thoughts of suicide, but that can change quickly. And if it should ever happen in the future, I want you to know that I care about you and I want you to be safe. You can say things like, that's really good to hear. I'm really glad to hear that you're not having thoughts of suicide right now. If that should change in the future with guns in your home, I'm a little worried about your safety. And I'm wondering what we can do to make your home a little safer until your situation improves, until things get better. Or you could say, that's really good to hear. I know you've got guns. Having guns in your home increases your risk. And I'm wondering if we could talk about ways that we can store those safely, so that if your situation changes, or you find yourself in a moment of despair and despondency, that you don't have that firearm easily and quickly to go to. So, again, I want you to practice asking the question, are you having thoughts about suicide? And I want you to envision that that a person that you're looking at, or maybe not looking at, is going to reply, yes, I'm having thoughts of suicide. So go ahead and look at your computer screen and ask, are you having thoughts of suicide? And in your head, envision that the person on the other side would say yes. Okay. So if there was someone on the other side of you actually saying yes to the question about suicide, I imagine you would feel really flustered and perhaps scared and concerned for their safety and their well-being. So what do I do? What do we do if that person were to say, yes, I'm having thoughts about suicide? Respond to them by saying, thank you for trusting me with that. I know that that must be really hard for you to have said out loud. You must be feeling really stuck without options, without any seemingly any options for things to get better. I'm really worried about you. Can you tell me what's going on? Can you share with me what you've been experiencing? Or you can say to them, I'm really sorry that you feel that way, and I'm glad that you shared it with me. Can you tell me a little more about your thoughts about suicide? People may be willing to talk about suicide when we demonstrate that we're ready and we're willing to listen to them in a non-judgmental way and in an empathetic way. So what do you do next after that they have said yes and we've replied to them, responded to them in a caring and empathetic, non-judgmental way? Let's express concern for their safety. How can I help you? What can I do? What do you need? What have you tried in the past that has been helpful? And then you can switch to talking about what can we do more to keep you safe? Explore with them their access to any and all lethal means, not just guns and not just pills, but explore that by saying, is there a way or is there a method by which you've thought about killing yourself? And they may or may not have thought about specific ways that they would kill themselves. And And if they haven't thought about a specific way, we want to include all lethal means. If they provide a specific way, we need to think of ways to keep that specific lethal means safer from them, or keep them safer from that lethal means. Also ask, do you have ready access to the way that you would end your life? Is it easy to access it quickly? In your home, do you have access to your spouse's guns or to your parents' guns? In your home, do you have access to the medications or the pills that you have thought about ending your life? Also, tell them about time and distance and how increasing the time and the distance from the lethal methods can reduce their risk for death. What can we do to put some space between you and that lethal method or those lethal means? What can we do to layer safety in your home? So some specific questions, some specific and pointed questions when talking about guns is, how long would it take for you to access a gun? You know, is there a gun kept in a nightstand? Is there a shotgun left on the back porch step because we live in the rural parts of the country and we live on a farm? Is it that the firearm is predominantly left locked up, but it's stored loaded? So how long would it take for you to access that gun? Asking this question establishes the potential timeline. It also helps to determine the immediacy of that person's risk for suicide. What changes can we do to reduce access to them? Can we shift that person's thinking towards safety? Can we get them to think about temporarily removing the lethal means from the home? Can we think about safe storage methods, making sure that all firearms are locked up, all medications are locked up, so that the person at risk cannot access them? Can we consider removing all the ammunition from the home, making it harder for a firearm to be lethal? Or can we ensure that the firearm and the ammunition that is stored in the home are stored separately? And then can we identify other folks for support to ensure, is there a relative that you would be willing to include in helping us reduce access to your lethal means? Or who do you want to be involved in this process? Who has been helpful to you in the past? Or that you would be comfortable going to and sharing this information as we work towards making your place of residence safer. Keep the conversation going by working together and possibly including others to find a plan to keep that person as safe as possible. You might be in a situation where you are not the primary caretaker or caregiver for this person who's at risk for suicide, because maybe you live across the country from your relative. So who else can we include in this process? Or do we need to include your adult children? If it's your elderly spouse, and you need to get your adult children involved, maybe it's getting that student's parents involved to keep that student safer. Don't leave that person who's at risk for suicide alone until you can trust that they can be safe. If you have a person in your home who's having thoughts of suicide and is at risk for suicide, and you can't keep the firearm secured for some reason, or you can't reduce access to all other lethal means, make sure that they're not left alone. With young people, if they want to spend time in their bedroom, make sure that their bedroom door is kept open so that they don't try and substitute other lethal methods. Make sure that they're not isolated and living home alone from those who can support them. Again, putting time and distance between a suicidal person and highly lethal means may save a life. I want to quickly show you a video of how this conversation can look. This video was created by our friends with the New Hampshire Suicide Prevention Coalition. This is a conversation between family members.
Regardless of the method used. So reducing suicide deaths is worth the undertaking. And if, as gun owners, we can reduce firearm suicides, then all the better. The majority of gun deaths in the U.S. are suicides, not criminal violence. As people who care about guns and gun rights, we can help bring those numbers down. How can lawful and responsible gun owners help? How can we make a difference?
Well, that was fun, yeah?
Yes.
Did you like the 686?
Oh, I loved it.
Cool.
When's the last time you spoke to your brother?
Yesterday. We were talking about planning Mom and Dad's anniversary party.
How did he sound?
Okay. A little down, but it's hard to tell.
Let's see if we can take him out to supper. You know, get him out of the house.
Yeah.
I'm really worried about him.
Hey, Bob. Mary. You guys didn't have to stop by. Come on in.
How are you holding up?
She came by today when I was out to pick up some things. And she took Samson. Can you believe it? My dog? She took my dog.
Are you kidding me? You had Samson before you even met.
I know.
We were just about to go get a bite to eat. Why don't you join us? It would be good to get you out of here.
Yeah, let's get you out of the house for a while, man.
No, I just want to stay here, okay? Look, guys, I appreciate you coming, but I'm fine, really. You know, just go to dinner. I'm all set. I'm fine.
We have some time before we go, so maybe we just stay a while. Give you a chance to change your mind.
Recognizing someone may be at risk is the first step towards helping to prevent a potential tragedy. Putting time and distance between a suicidal person and a firearm just might save a life.
Hey, Stuart, so we were thinking of getting Mary in 1911 in 9mm, and she really liked your Colt when we went shooting last summer. Do you think we can borrow your Colt? Just for about a week, you know, just so we can take it out to the range and see if it's what she likes. You still have it, right?
Yeah, I do.
Listen. We're worried about you. Do it for our sake. At least until the worst of this blows over.
Suicide deaths are terrible for everyone involved. Firearm suicides also hurt the cause of liberty when the numbers are used to justify more gun laws. Let's work together to reduce all suicides, especially the ones where a firearm may be used. Sometimes getting involved at a critical point during someone's despair may make the difference. You may think that a suicidal person without a gun will just find another way to die, but virtually anything they might substitute is less likely to kill them because guns are so quick and so effective. Other people may delay their attempt because suicidal feelings often come and go. The more time and distance you can put between a suicidal person and a gun, the better their odds of making it through alive. Who is best suited to address this issue? The government or responsible firearm owners? Who has the best chance of actually saving lives? Simple steps by friends and family that show you care sometimes save a life.
So we saw there just a little demonstration of how that conversation could start just by expressing care and concern about the person. So ask and encourage safety. Identify people who could help. Who do you trust to hold on to your firearms while you or your loved one are at risk for suicide? Depending on different states and their gun laws on legal transfer of firearms, we want to ensure that we aren't transferring a firearm in a manner that violates law. Fortunately, in Missouri, we don't have that roadblock. As long as the person is legally eligible to hold on to a firearm or to possess a firearm, if they can do that safely and store it so that they aren't putting anyone in their home at risk, we can pass that firearm to any legal adult who's eligible to possess a firearm. Explore concerns about temporary removal. What are some roadblocks, or what would make it difficult for us to temporarily store the firearm outside the home? Some states have transfer laws in which the transfer of firearm has to be logged and registered, and it can only go to it can only be transferred between certain entities. Meaning that it wouldn't, in order for me to transfer my firearm to my relative, even for temporary holding onto, that transfer has to be legally recorded by a federal firearms licensee. So that might be, that in some states, not in Missouri, but in some states, that might be a roadblock. As well, there might be some beliefs and concerns about gun ownership that makes it difficult for a person to be comfortable to relinquish their firearms, because that's part of identity. It's part of who they are. And so therefore it's kind of like taking, it's akin to taking the keys away from your elderly parent in some ways. They see it as a loss of freedom and independence. Explore home safety. What are some things that would increase firearm safety within the home? What are some things that we can do to layer safety? Perhaps there are too many firearms in the home to remove all of them. Could we purchase a large gun safe to store all of the firearms? If purchasing a gun safe is not an option, can we purchase trigger locks or cable locks that would increase the time in which that person can access and fire the firearm? Can we make sure that all of the ammunition is removed from the home? That way, the only way to make the firearm fireable would be to go and purchase additional ammunition in that time that it takes to drive across town to purchase additional ammunition. Something may happen to interrupt that suicide plan. As well, perhaps we could make the firearm, render it so that it can be fired by disabling it, by removing the firing pin or the firing bolt. And then make a specific plan to follow up so that we agree that in order to keep you safe, we need to do ABC 1, 2, 3. We're going to do this temporarily just to keep you safer until things get better. So what are some options for temporarily removing a gun from the home? Temporary off-site storage of all guns is the safest option. But sometimes having a friend or a family member who's legally able to possess a firearm isn't an option. So let's explore other options. Perhaps a storage facility is available within your community to provide safe storage. Some gun shops, shooting ranges, or gun clubs offer inexpensive storage options where you can lock up guns in a gun locker. Perhaps consigning the firearm at a pawn shop for a short period of time where they have to legally store it, and you take out a small loan against that firearm and you pay the service fee on that loan, and then in a few months you can either extend the life of the loan or have the firearm returned. Sometimes law enforcement might be able to store firearms for that person. It really kind of depends on your location and your local law enforcement agency, but they'll definitely dispose of firearms if you no longer want that firearm. All of these options do involve a formal transfer of guns, and depending on your state, it may require the federal firearms background check in order to have them retrieved or returned to you. So you want to be aware of what the requirements are with that agency or that entity with which you turn your firearms over to. If temporary offsite storage isn't an option, make sure you lock all guns in a gun safe or a lockbox. Remove the ammunition from the home or lock it separately. If their guns are already locked and stored in a gun safe, that's great. Let's change the combination on the safe to one that the person at risk for suicide doesn't know. Or if it's a key, let's take the key and remove it from the home. Perhaps we take it to the safety deposit box at the bank so that having access to that key slows their time, or they don't have access to the key at all. Use some distraction techniques. Place a National Suicide Prevention Lifeline magnet or sticker on the gun safe with the 1-800 number so that they have that access to that immediate resource for help if they're at risk for suicide. I have a colleague who places a photo of his grandchildren inside his gun safe so that if he should ever go to reach for his firearm in a moment of despair and despondency, he sees his beloved grandchildren. Perhaps if you freeze the keys in ice in a tin can, it would make it more difficult or increase the time for which the person would have access to a locked gun safe. Again, take the keys off site, or if you have absolutely no other option, bury the keys in the yard in a place where that person at risk for suicide doesn't know. Other safety options are cable locks or trigger locks. They are not fail-safe. These can be manipulated and overridden, or depending on what you use. It's not 100% guaranteed, but it can increase that time that person has before that person has access to firing a firearm. If a person needs to have access to their firearm for self-defense, or they say that they need their firearm for self-defense, that may be a very legitimate reason to have a firearm, but during this time, they're at greater risk for suicide than they are at risk for a home invasion or being assaulted. And so therefore, it's better to use some other means of self-defense. Perhaps it's keeping a baseball bat in the home, or purchasing mace, or installing a security system in the home. Consider creative solutions. Again, that example of putting pictures of loved ones in a lockbox. If self-defense is essential, urge that someone else holds on to the firearm. Someone else in the home has that firearm, or that the firearm is stored in a biometric gun safe so that only one person with those fingerprints can unlock the gun safe. Or if the person uses the firearm for their employment, maybe they're in law enforcement or the military, then that firearm should always be on their person and that they know that they are the only ones that have access and control to that gun. And when they take it off at night, it gets locked up in a gun safe. A locked gun poses a lower suicide risk than any unlocked gun, no matter who holds the key. An unloaded gun poses a lower suicide risk than a loaded gun. Hiding guns is usually not effective since families usually know our hiding spaces. I was that kid who knew what she was getting for Christmas every year because I knew where my parents hid the Christmas presents. So don't assume your kids don't know where things are hidden. Those who are familiar with firearms may actually be at higher risk for firearm suicide because they know how to properly utilize that firearm. They've been trained on how to load it, and therefore they may be more at risk. And add emotional distress to reasons for safety. Maybe it's children. Maybe it is people are not familiar with guns. Oh, I'm sorry. Okay, maybe they add emotional distress for reasons for safety. That children are not supposed to be left alone with firearms. People who may not be familiar with guns that come to your home could come to your home to acquire a gun, and do you know that your gun is safely stored from those who come and visit you? So what about other methods? Well, with medications, we want to be sure to safely dispose of out-of-date or unused medications. We want to reduce the quantities of medications that are kept within the home. The person at risk for suicide should not control large quantities of medication. And then utilize a refill, a pill box and dispense of medications in smaller doses so that they don't have access to lethal amounts of medication. Use a lockbox to safely secure lethal meds. And then involve a pharmacist or a poison control. Call and find out what are safe levels of your medications to have in the home or have accessible that might be accessible to the person at risk for suicide. Other methods, it's almost impossible to remove all means. So keep an eye on the person who's at risk for suicide. Keep the door to the bedroom open. Reduce other access to other methods whenever possible. Maintain physical and emotional contact, and then focus on other ways of increasing safety. Remember, reducing access to lethal means is only part of suicide prevention. So practice makes perfect. Make sure you're familiar with the warning signs. Express your concerns for their safety. Ask them directly, are you comfortable? Or as directly as you're comfortable, are you thinking about suicide? If they reply with a yes, reply with concern and empathy. Ask about their access to lethal, and then ask about access to lethal means. Remember, when you begin with concern and empathy, the conversation does not have to be confrontational. Focus on increasing safety without judgment regarding firearm ownership or medications. Discuss that this is temporary until things get better. Be familiar with medications or being familiar with medications or firearms may actually increase rather than decrease someone's risk, and it involve others in preventing suicide. Get help if you need it in preventing suicide of a friend or a loved one. That concludes this webinar. If you have questions, I know that there is a way to submit questions. And then the call to action. Adopt the 11th commandment of home gun safety. Talk to your family about calm and reducing access to lethal means in your home. Share this training with other gun-owning friends, the knowledge that you learned. And then ask your local firearm retailers in your community to host a calm training for their staff and for their customers. There are some resources available for more information if you would like to look deeper. And that concludes this training.
Well, thank you so much, Katie, for that information. That's certainly great information for everyone to have. Again,